Good evening. Immigration and its impact on employment and social services has often been a matter of great debate and contention. The adverse effects of socio-economic challenges on the mental health of South Africans is well recognized. But what about the mental health of people who have migrated to South Africa in search of a better life? And Dr. Stephen Gordon of the Human Sciences Research Council argues the mental health challenges faced by external migrants in South Africa is a topic that has garnered enough attention, and its addressing it can only have positive results for the building of a prosperous South Africa. And Dr. Stephen Gordon joins us now for more on this discussion via our video link. Dr. Stephen, thank you so much for your time this evening. And I must say that, we always talk about mental health, but we barely talk about what it does actually and how it affects migrants, especially who come and work here in South Africa. What does your research say about the mental health of migrants, particularly here in South Africa?
Well, thank you very much for talking about this extremely important and time-sensitive issue. South African academia has focused a lot of attention on mental health in the last 20 years. We've made great strides at looking at the mental health of various communities, but the external migrant community, the international migrant community, has been understudied and overlooked. This research addressed levels of depression amongst poor and working class migrants in 10 township communities in South Africa in which a lot of international migrants live. We were able to identify drivers of depression and look at the distribution of depression amongst this population. In particular, we identified that migrant women were very vulnerable to mental health issues, living as they do with multiple challenges and multiple vulnerabilities. Our research suggests that there are practical and straightforward policy interventions that can take place to help promote the mental health of external migrants. This will have a positive impact on social cohesion, societal well-being, and forge the kind of peaceful, cohesive communities that we all want in South Africa.
And, speaking about this topic, what would you say are often the challenges that migrant workers often come across, especially in South Africa?
So there are three main drivers of mental health problems in South Africa, and they probably will not be surprising to many of your listeners. They are poverty, social isolation, and discrimination. Poverty, of course, we can understand, causes many mental health problems. Limited access to material conditions coherent with a decent and good quality of life, water, electricity, proper housing. This creates a lot of problems. Indeed, it also creates problems about anxiety for the future, undermining and creating stress. Secondly, of course, discrimination. Immigrants face many levels of discrimination, not just due to their status as migrants, but also due to their gender, their religion, the language that they speak. And of course, finally, social isolation. One of the more interesting findings from our study was that if external migrants had friends who were South African nationals, they tended to be better integrated, they tended to be happier, they tended to be less depressed. And this had a much stronger effect on their mental health than simply being friends with their fellow external migrant peers. So this points us to some very clear and straightforward interventions that can help improve the mental health of external migrants, and really centered us on the issue of immigrant integration policy. Now, currently, South Africa is debating its immigration policy as the National Parliament looks at the new Immigration Act, reforming all pieces of legislation. We must think seriously about our commitment to looking after the well-being of everyone who resides in South Africa, and thinking about effective and progressive ways to guarantee that everyone in our country is living the best life possible.
And I mean, you touch on a lot on when it comes to isolation, and you also say that those migrants who integrate and interact with more South Africans, they've got less impact when it comes to mental health. And looking at isolation, what does it actually do in terms of how it affects migrants? And, you know, do you often find it that most migrants find it difficult to integrate?
Many migrants struggle with integration for all sorts of reasons. There are linguistic challenges to integrating into township communities. There are challenges regarding pre-existing prejudices against migrants, making it difficult to join civil society organizations, to participate in various forms of community government, and to just use basic services, you know, attend schools, go to clinics, go to sporting events. One of the great things about an integration program, it would help external migrants join such organizations, integrate into local community activities, and build the kind of social fabric and interconnection that builds strong communities in South Africa. All human beings need social connection. We need social community. We need to talk to other people. We need to hear their stories, laugh and cry with them. Social interaction is a basic human need. And we need to recognize that amongst everyone in South Africa, not just nationals.
And what would you say is the impact when it comes to the threat of xenophobia? I mean, that's something quite unique to South Africa that we often deal with, especially when it comes to our fellow African brothers and sisters. You know, the threats of xenophobia, what does that do to migrant workers?
Prejudice, when faced by anyone, can cause serious psychological damage. No one likes to be discriminated against. As South Africans, many people have personal, first-hand experience with discrimination and know the deep psychological toll that experience can have. South Africa is not the only country in the world which experiences anti-immigrant sentiment, anti-immigrant behavior, struggles with problems related to xenophobia. But South Africa is in a unique position to fulfill our mandates and our dream of Pan-African unity, regional integration, building that dream of united Africa. Too often we feel the urge to isolate ourselves from our brothers and sisters on the continent, to feel that outsiders can only mean trouble, when in fact there is a clear and prosperous path towards regional Pan-African union and integration that we can follow, which will allow us to achieve economic and social prosperity, while at the same time opening ourselves up to African migrants, to people from across the continent, so we can build shared, progressive prosperity together.
What can be done to improve the state and well-being of migrant workers in South Africa?
With some few very, very straightforward, very simple things that can be done. So, as I mentioned before, immigrant integration policy, very straightforward, helping people join civil society organizations, helping them with language courses, helping them with economic and social integration, helping them with protection from discrimination, helping them access those services that they are legally entitled to as people living in South Africa. There are many good models that we can learn from all over the world. You know, some quite wealthy countries such as Canada, who have spent many decades working on integration policies. Some from poorer countries, you know, think about Portugal, for example, which despite having a relatively limited budget for these sort of activities, and it has been able to make significant progress in terms of integrating people from many different parts of the world into Portuguese society and helping them make positive economic and social contributions.
All right. Dr. Stephen, thank you so much for your time. That is Dr. Stephen Gordon. He is from the Human Sciences Research Council.